Hey everyone, and welcome to episode 24 of That Gives Me Anxiety. In my notes here, I make a little rundown for the intro and the outro, just to be able to collect my thoughts and know what I'd like to talk about before I ramble. And the first thing I put was relaxing weekend, but that's not true. The next thing I wrote, and this is true, and it's kind of on the sadder side, or just is, was that I'm surprised how much mowing the lawn, weed whacking the lawn, kicks my ass. Did that on Saturday, and Saturday morning, almost as, slept in a little bit, but then jumped out there and did it. I couldn't move after that. I mean, granted, it was supposed to rain, so I was trying to rush it in and try to get it going. But geez, with trees, you can see how old they are by cutting them open and seeing rings. I think with adults, it's how many episodes of Schitt's Creek you need to lay down and watch after mowing the lawn. It was a lot. It was a lot. Well earned, Really well earned. And to further disprove the first thing I wrote about this being a relaxing weekend, I also did a show. As I'm choking on an almond. Did a show at Theater 99. I don't know who these people are. It was a great show. Overall, the crowd's always good. But there's always that one person in every short form improv show. So we do short form and long form. And so short form requires a lot of suggestions. People are shouting out things that were, what's the scenario? What's a relationship? And there's always that one person that just Frankensteins their way in, hammered. And then for every suggestion, yells dildo. God. And of course you acknowledge it and make fun of them, but it's why? The cool joke, man. Yeah, you said dildo. Awesome. But yeah, like I said, still a good show. Anyway, we've got a great episode lined up. Today our anxiety is caused by addiction and trying to get sober. Certainly not a light subject. We all know somebody who struggles with addiction. And so in this episode, we're going to talk about what it's like to try to get sober and how you can support someone who's trying to get sober, no matter the substance or addiction that they are suffering from. And so I want to thank my two guests. First off, Patrick McCartney, who's a friend of mine, a very talented comedian, improviser, teaches improv at the People's Improv Theater in New York City. If you don't know Pat, you may recognize him from the movie Elf. He threw Buddy the Elf out of the office. He's one of the security guards there, which is so fun every time, I watch that movie and just see Pat in there. But yeah, Pat was very open and honest about his journey to sobriety and how AA was helpful, and really stresses what a gift sobriety can be. And I also spoke with Dr. Chuck Smith, who is a doctor that helps people who need to detox, helps them through it. It tries to make them as comfortable as possible as they go through something that I would imagine would be just excruciating and awful. And Dr. Chuck Smith himself also went through recovery, and so he knows what it's like. He's been on both sides of needing help and then helping others, so he offers a really unique perspective. So yeah, thank you to the doctor as well. Well, let's make our way over to the interview, but before we do that, just to remind you, if you're liking the show, please remember to rate and review it on whatever platform you're listening to it on. You can check the show out on Facebook, Instagram, Twitter, and YouTube, or YouTube. If you just want to pick one. And if you're liking the show and you want to support it and support me as I try to make these in my free time, there's the Buy Me a Coffee link, which is where you can buy me a coffee. If you're liking the show and you want to say, hey, Pat, thank you. And you want these to keep getting made, donations like that go a long way. So yeah, thank you so much. And the link for that is in the description. All right. As always, thank you so much for listening, and enjoy. Joining me now on the podcast is my friend Pat McCartney, who's an actor, comedian, and teacher of improv and sketch and pretty much everything at the People's Improv Theater, The Pit in New York. Pat, how's it going?
Good. It's good to be here, Patrick.
I know. We go a ways back at this point.
We do.
Yeah.
I think I probably met you when I was 2 years sober.
Okay.
Yeah.
Yeah, you were like just coming back into the improv world.
Yeah.
I think what was it called? The space was like the Treehouse Theater or this theater, whatever it was at this point.
Yeah.
Yeah, I think, and then you became the coach of Bueller with Mehdi and Matt and all those guys,
Yeah.
and then I think you worked with every group I had going forward, of which there were quite a few.
Yeah. I just saw Sarah Morgan Ashley. You guys were on a team together. Yeah.
Yeah, we were on
Yeah.
two teams, maybe. Yeah.
Yeah. With Matt Morrison and you.
Uh-huh.
And yes. Yes. She's still around.
I'm having her come on here shortly to talk
Oh,
about her
cool.
business. Yeah. Absolutely. Well, I mean, the one show that stands out to me is the Sauce and Jones shows, which just was
early experimental. That was so fun. Seeing the dynamic of you two is what excited me about putting those. Mike Sauce, the great Mike Sauce, and you, Patrick Jones. Do you prefer Patrick or Pat?
I go back and forth. I always introduce myself as a Patrick, but then when someone reflects that back to me, I'm like, whoa, what am I wearing, a tuxedo? Like, I'm Pat.
Yeah, that's good.
Yeah, which I think you usually go for as Patrick. I think
I try, and people always just go Pat. I must have a Pat vibe. You and I have a Pat vibe. We have a non-tuxedo wearing vibe.
Yeah. Exactly. Well, thrilled to have you on here. We're going to be talking about addiction and trying to get sober and what that was like for you. And for the listeners, I also interviewed a Dr. Chuck Smith, and he is a doctor who helps people with addiction and also suffers or suffered with addiction issues in his past as well. So we're going to intersperse that. But I don't know anything about your story. So tell me a little bit about your journey to sobriety. I mean, was it, I imagine rarely it happens where it's just like, all right, I'm going to be sober. And then it is. I imagine it was some give and take.
Yeah, it was a long time for me to think I could possibly live in the world without drinking. And it took what people call many bottoms. And like your doctor friend talked about, relationships, jobs, all the consequences had happened and were happening again and again, to the point where I didn't go to a rehab or a detox. I went alone to a cabin in the woods in Wyoming. And then I managed to come back to New York, and I detoxed in the rooms of AA.
Oh, okay.
And I was on, it was alcohol, and I was a heroin addict in my 20s. So I was on an opiate replacement called Suboxone for years. And then I kicked that, and all the ways I sort of stopped doing what I was doing. I mean, AA is great, but I would definitely say what I did is unusual in that I should have probably been in a medical facility.
Right. Absolutely. Well, yeah, I mean, that is unusual too. The ability to know, I mean, I guess it's not unusual to get out, right? And to go to Wyoming must have felt like a good way to approach it, because you're out of your social circles. You're able to step out and just sort of clear your mind for a little bit.
Yeah, I mean, well, that's what we call a geographic. So that's the sort of the idea, wherever you go, there you are. So I still was drinking in Wyoming. I thought if I got out of New York, I'd get away from the drugs. I still was in denial about my alcoholism. I was basically just unable to function. My life had become completely unmanageable. And I knew someone who had a cabin in the woods in Wyoming. And I thought, if I go there, for some reason, everything would be better.
Right.
And I'm a New Yorker, and I was in the middle of Wyoming, and it was a very dark, cold, creepy experience.
I'd imagine. Yeah.
It was, it was like The Shining, except no family members. Thank goodness.
Right.
And it was me and my demons.
Well, which when I said that before, it's like being inside my own mind at times is like the scariest place in the world. It's just like you begin to
Yeah.
start talking to yourself, and like at that point, you're your own worst enemy, right? Like you're not being nice to yourself.
Yeah. Yeah. The that inner dialogue, that those things, that's where the steps come in as
Mm-hmm.
far as recovery and meditation,
Okay.
which I practice every day. And I use Sam Harris's app, his Waking Up app.
Okay. Yeah, I've heard of that. Yeah.
And it's incredible. It's life-changing. And I started at 10 minutes a day. Now I do 20 minutes a day. And in the steps, you add prayer to that as well. So you sort of try and embody a usefulness. But meditation is so helpful with the thoughts, for sure.
Absolutely. I'm curious. You mentioned, there being several bottoms. Does it just get to the point of like, oh my gosh, I don't want to hit, like I've hit this bottom multiple times. I got to get out of this. Is that the feeling? Is it just like, how do you break free or try to get on the path to recovery? Did you have someone sort of say, hey, Pat, like this needs to happen, or it came from you?
That's a good question. I think people over the years had said, hey, Pat, this needs to happen. Several friends had taken me to meetings during, but the thing about the addict is it's very hard. Like the doctor talks about how it's really up to the addict to die. I mean, alcoholism is a self-diagnosed disease. I can tell someone they're an alcoholic, but I mean, and people did over the years. And I said, yeah, that's why I drink. What it meant to go into recovery was very different. It's hard to sort of pinpoint, the desire to stop drinking is really what it comes down to. And then to try and understand what sobriety means. But even when I first got into AA, when I was going into the rooms, I didn't really want to stop drinking. I just needed some kind of help, and I wasn't sure what it was. And it's a great sort of relief to find out, oh, this is the problem.
Oh, yeah.
I'm an alcoholic.
Right. Well, I guess it's good to, what I'm hearing is that it's not like this aha moment where you just get out of bed and you're like, today is the day that I stop. It's just more of a gradual experience that you're sort of moving towards. And you may be even in denial the whole time, even as you've begun the process.
Well, I think it's different for everyone.
Mm-hmm.
And yeah, for me, I was in denial. I mean, it took a couple of things. Like when I first got sober, the actor Philip Seymour Hoffman had like just died, like 2 weeks into my going into meetings. And I remember, and he overdosed.
Yeah.
And I remember that had a huge impact on me because, I mean, as an actor and performer, you kind of look at somebody who has all the things and you're like, well, how could they do that? So the idea that this was a big disease was sort of landed around that time. And that's when I decided really one day at a time to not fantasize about drinking. Because I thought and when you first enter the rooms of any 12 step, you go through a 90 and 90 meetings in 90 days. And the idea is, I think, like, if you can come in and stop drinking for 90 days and listen to people in the rooms and you don't identify and it's not a problem for you to stop drinking, then you might not be an alcoholic. But if you come in and you do it for 90 days and you start to identify and it's difficult to stop drinking, then you probably are an alcoholic.
Right.
So in my 90 and 90, I was still fantasizing. I think about 14 days in, I was still fantasizing that when this 90 and 90 is over, I could probably drink beer or champagne. I didn't understand until around that time that actor died. And then, I mean, that was a big one. And then, and hearing people in the rooms and really admitting to my innermost self that, oh, wait a minute, I'm an alcoholic.
Yeah. Well, I guess it's good then to set like 90 days, because there's a lot of time in 90 days, especially if you're going to meetings and really thinking about your relationship to whatever it is at that time.
Yeah,
That's a
whatever
good
you're
chunk.
powerless over.
Yeah, right. Absolutely. Well, I think this is a good time to go to the first clip where Dr. Chuck Smith introduces himself and shares his story and talks about interventions. So let me get this straight. In today's day and age, you're supposed to be drinking a ton of water, doing yoga, making sure you and your whole family is happy, strike a good work-life balance, exercise, read books, watch movies, eat healthy meals, be a big part of your community, and get 8 hours of sleep. It's unrealistic. It's too much. Well, that's why there's Instacart to take a little bit off your plate, or help put a little bit on your plate. Oh, I'm so sorry. Using Instacart, you search for all your favorite foods and items that you need from the grocery store, fresh produce, all your favorites, everything you want, and they deliver it to you. They go to the store and do your shopping for you. Just remove it from your to-do list, just with a few clicks. And you'll have your items delivered to your door in as fast as an hour. It's pretty quick. And through the link in the episode description, they're offering free delivery on your first order over $35. But you got to make sure you click the link in the description. That tells Instacart that this show sent you and it helps support the show. And you can also take advantage of the free delivery. So yeah, be nice to yourself. Give Instacart a shot. Joining me on the podcast is Dr. Chuck Smith, who specializes in addiction. Chuck, can I call you Chuck?
Yes, sir.
Yeah. Thank you so much for your time. I'm thrilled to be able to speak with you today.
Thank you. I'm glad to be here.
Well, why don't we start? I mean, this is such a almost at times taboo subject in our culture to discuss getting healthy with addiction, and there seems to be such a debate on how we view addiction. Some people view it as a disease. Some people, unfortunately, still have more older vantage points. But why don't we start by you introducing yourself and talking a little bit about what you do?
Hi. Well, as you said, I'm Dr. Chuck Smith, and I'm an addiction medicine specialist in Hollywood, Florida. I work for Recovery First Treatment Center, which is parent company American Addiction Centers. I've been with them about 4 years now. I completed my addiction medicine fellowship at the University of Florida 2016 to 2018. The other thing that might make my introduction needs to be stated was that I played on both sides of the table. I was a family practitioner in West Virginia and Kentucky for 26 years until I went to treatment myself for addiction to alcohol and opiates in 2009. And that's what spurred my interest in addiction medicine and then subsequent retraining and my work I do now.
Oh, wow. And so how many years have you been sober?
12.
Congratulations. Congratulations.
Thank you.
Yeah. Well, that you certainly bring a unique perspective to this discussion. If you feel comfortable, I'd love to find out a little bit more about your story and how did you know when it was time for you to seek help?
Well, that is interesting. I had strong family history of problems with alcohol. My father, grandfather, uncles permeated both sides of my family. I was a binge drinker in college, medical school. I didn't drink so much because I probably wasn't going to graduate if I did. So I was able to curtail it. But looking back on it, it made me sad. I was not happy that I couldn't drink like I wanted to. So as I started to practice in my early 30s, my alcohol use escalated. And as marriage, work, dealing with insurance companies, trying to run a private practice, it was very stressful. Now I know why. That increased my drinking even more. So in my 30s, I started coming to work basically with alcohol poisoning. So very sick, very sick. Mm-hmm. And that was about the time in the late 80s they started sampling Vicodin and Lortab or hydrocodone. Mm-hmm. So I certainly knew better. I was a trained physician, but I was sick. So I got into some of those, and certainly they relieved my symptoms. And they turned out they relieved my symptoms a lot. So Honestly, from the mid 30s for the next 20 years, my life was a blur. I never got off those. I obtained them many different ways. I ordered them wholesale. I got friends to write them for me. And near the end, I was practicing at a clinic in West Virginia, a state-ran clinic, and me and the ex-girlfriend had been collaborating to get fraudulent prescriptions filled. We were getting about 3,000 pills a month.
Oh my gosh.
Then one day at the clinic, the nurses came back and said, Dr. Smith, there's two DEA agents here to see you. And that was November 22nd of 2009. I'll never forget that day. So the two DEA agents came in and said, we would just like to know one thing. What is wrong with you? So I said, well, I guess I'm sick. And the one said, if you've been selling those, you're going to prison. I said, I don't sell them. He said, one person can't take that many. And I told him I run out sometimes. So I subsequently went on to treatment. I was out of medicine for 7 years. I got trained in both addiction interventions and addiction counseling. And then I was fortunate enough to be accepted by the University of Florida in 2016 to do an addiction medicine fellowship. And that was my pathway back into medicine. So what brought the answer to your original question, what brought it to my attention was the federal government.
Yeah.
That was my intervention.
Yeah. Yeah. Sorry to laugh. It's just very plainly stated.
Well, I can smile about it today. I promise you I wasn't then.
Right. Of course. I'm sure it was a daunting experience. Yeah. When DEA agents get involved. So let's talk about someone who is addicted. I mean, do you approach different substances differently? Do you approach, let's say, someone who's addicted to opioids differently than someone who is a heavy drinker?
Actually, I don't, even in my work. I mean, our detox is certainly different for different substances, but the treatment is not. As they go through detox, residential, a partial hospitalization, or outpatient, our treatment doesn't focus on the substance. But the detox, it certainly does, because we treat them medically different. As far as the intervention prior to coming to treatment, no, I treat all the substances the same. And when I did interventions prior to getting back into medicine, what I always even then tried to stress to family, treat this as any other sort of medical emergency. As you mentioned earlier, it certainly is awkward. There's social stigma attached to addiction and use of drugs or use of alcohol. So many people are certainly shy or backwards about approaching a loved one over this. But I think about this all the time. If you had a loved one who was experiencing chest pain, you wouldn't sit still and not get them to a cardiologist.
Right.
You had someone who had a bleeding disorder, easy bruising, any sort of physical ailment that you noticed, depending on just how close you were to that family member, you would not give up until they sought professional medical care. Mm-hmm. And quite often with this one, it simply doesn't happen, because the patient who's using will make all sorts of promises. Well, I'll cut back on my own, I'll do this or I'll do that, but very, very seldom does that happen if they truly have the disease. What I always strive for doing interventions, and still now, is ask them to at least agree to a professional examination by a behavioral health, a medical person, so that we find out just what is your use. Is it problematic, or are you just a social drinker?
Right. That is it. So that is a good foot in the door to at least get something.
I just tell families, and certainly I did this when I did interventions too, then expect the patient to be resistant. Mm-hmm. I mean, it's the sort of disease that damages your decision-making process and your perception. So you do have to be firm, persistent, and I think at least when I use tough love, that's where it comes in at this point, is I'm not going to settle for you not getting an evaluation. It's not my job as a family member to tell you you have the disease or you don't have the disease. I'm just asking you to get professional help, as I would with any other medical problem.
Yeah. Well, I think a lot of people may struggle with, when does an intervention need to happen, right? I feel like there's this especially with alcohol, people being like, well, if they're not hiding vodka bottles in behind the toilet, they don't have a problem. When do you think an intervention is helpful or necessary?
Well, certainly if the substance has started to cause relationship problems, if it started to cause work problems, or if you know that it's caused them health problems. We actually have a screening tool that has the mnemonic CAGE, CAGE, and family members can easily do this, and we're just asking that the patient be honest with them in their answers and that the family member recognize it too. But on CAGE, the first one is, have you tried to cut back and couldn't, or curtail your use and you were unsuccessful? The second one is, are you annoyed or angry when someone calls you out on your drinking? Or, if you say, hey there, you drank 14 beers last night. What were you trying to do? Or did you really drive intoxicated? Or you're slipping here at work. Your work's getting backed up. And if that annoys you or you get angry over it, that's a positive answer. Third one would be guilty. Does the patient feel guilty over the use? Did it cause them to miss, an event, a birthday, a party? Did they wreck a car? Something they felt guilty about in their use. And the fourth one is eye opener. Do they use first thing get up in the morning? Or, for example, they're going to a Christmas party and they're slamming shots at home before they go. They needed a confidence builder or a head start on the other people. And answering an affirmative to any of those four questions should prompt a professional evaluation where we're going to get more in depth, find out just how much they drink and use, what effect it's had on their personal life, their work life, their physical health. But just answering one of those should prompt an evaluation.
Just one. Wow. Yeah. I mean, I guess.
Well, when you think about them, see, each one is problematic.
Yes, it is. Yes, it is. Yeah. Why not get a behavioral specialist involved? It is not the end of the world to just know what you're up against, as opposed to just continuing to sweep it under the rug.
Yeah, we certainly go for medical evaluations and screenings for much less.
That's very true.
Diabetes testing, cholesterol testing, cardiac stress testing. We even see ads periodically for whole body CT scanning, maybe even on a patient who's asymptomatic, just to try to find some early disease. And by the time you answer yes to one of those questions, you probably are past early disease. You probably are getting pretty advanced.
Right. So did you have an intervention?
I did not have an intervention. There was no intervention.
So, do you think you would have reacted well to opening a door?
Probably not.
Yeah.
I never went to rehab, like I said earlier, and I who knows? I know people that have gone in rehabs multiple times. I know people that have gone in and out of jail multiple times and still don't stay sober. I don't know what happens. It's like that endless mystery. What does it take to get someone sober? It really is a mystery. It's a mystery. It's a mystery.
That so many families are constantly looking for that answer to. Yeah. Right. Even as we mentioned, and the doctor mentions, like, people can lose their families, they can lose jobs, they can lose whatever they hold dear to themselves and still choose, not choose, but still be wrapped around.
Well, you've lost the ability to choose.
Yeah.
Because you're choosing something that you're doing something over and over. They say a lot in 12-step meetings that you're doing the same thing over and over again, expecting a different result. Which is Albert Einstein's definition of insanity. So you've lost the power to choose. You're just sort of doing this thing over and over again, and you think that somehow it's going to make it better, and it just makes it worse over and over and over and over and over again. And so then you finally have lost the power to choose. You have become powerless. And And that's the first step.
Yeah. Just coming to terms with that, I'm sure. And
Coming to
then,
terms with the idea that you just don't have, you're unable to drink normally and safely. You're
Mhm.
unable to drink like a gentleman.
Right. Well, the doctor mentioned something that really stuck in my mind, and that is when he was in medical school, he couldn't drink like he wanted to, and he sort of started grieving in that
Yeah.
sense. Like, that's a heavy word to use towards that. Is that something that you experienced?
When I got sober, you mean?
Yeah, yeah.
Uh,
Like sort of grieving the person that you may have been, or some idea of yourself, or
No, I mean,
no.
I never really did the thing where I was going to stop for a thing for medical school. I didn't go to medical school.
Mm-hmm.
I was in show business, and when I got sober, the idea of never drinking again, that's the overwhelming thing.
Mm-hmm.
It's like, never again, what? And
Yeah.
then you sort of try and learn it's one day at a time. And I mean, you never know. Who knows what'll happen? I mean, I've been sober over 8 years, and I had a fantasy the other night of drinking for the
Wow.
first time in a long time.
Yeah.
Sometimes you'll have drunk dreams, and you'll wake up, or I'll wake up and be greatly relieved that I didn't drink.
Mm-hmm.
You never know what's gonna be the thing. But I felt like I had done enough research when I was very filled with gratitude and relief when I started to not drink.
Yeah. I mean, this is in no way a comparison, but the few times that I've done dry January, it usually leads to dry February because you feel great, right? Like the mornings are easier. There's no looking forward. Like, it removes the lock on my mind to be like, oh man, at the end of the day, like, that's what I'm gonna do. It just, and you feel great. And so yeah, I understand the, like, it's so hard to get started. And again, like, in no way am I comparing my experience to, but
even
it
with
is,
something like dry January, if I were to do something like that as an alcoholic, all I would be looking forward to would be the end of January.
mm-hmm.
You
Okay.
know, when I could drink again.
Just
There would be no celebrating the moments in between. There would just be what we call white knuckling it. I would be probably on one hand feeling better, but mentally the obsession to drink would be there.
mm-hmm. Yeah. So then you described sobering up in the AA rooms. I don't know what that means. Is that sort of like an inpatient thing, or is it?
No. That's just like going to meetings and
Okay.
feeling your body and being for me, I was getting off Suboxone. I got off Suboxone mostly in Wyoming.
Mm-hmm.
So most of the vomiting and all the other terrible side effects of getting off an opiate were past, but I had to get off alcohol. So I was very lethargic and shaky and emotional, and everything hurt, depressed, angry, all sorts of things that probably go on in a detox.
Yeah. And do you feel, I mean, does AA help with like the mental aspect like that, where you're saying, you're experiencing depression and stuff like that?
Well, AA helps with the 12 steps help with, for me, a way of living in reality that is joyous.
I mean, that's incredible, right? Like that's the goal.
Yeah, it's pretty incredible.
Yeah, absolutely.
Yeah.
I want to ask you about the first time that you're at a meeting and you have to say, hi, I'm Pat and I'm an alcoholic. I mean, Patrick. Yes. I'm wearing a tuxedo. So I wore this tuxedo to my AA meeting. Was that difficult, or was that just sort of like, I'm here?
In the beginning, I just wanted to say addict.
Okay.
I didn't want to let go of the drinking.
Yeah.
I just wanted to sort of I was like, okay, I can do the drugs. So I'll put the drugs aside, but and then yeah, like around the same time that everything sort of changed. I mean, I saw a play about Bill W. and Dr. Bob, the two men that started Alcoholics Anonymous.
Mm-hmm.
And then the actor died. And then a couple of things happened that made me start saying I'm an alcoholic.
And I'm sure, at least, I mean, from a mental perspective, I could see it being easier once it's framed as such, to be like, I have to keep going on this path.
Yeah, I don't think anybody, nobody has to say anything you don't have to say your real name. You don't have to say you're an alcoholic. You don't have to say, but at some point, hopefully you just start to become honest with yourself, and you identify as however you want to identify in an AA meeting. That's the great thing about AA. There's really no judgment. If you want to come in there, there's open meetings for people that just want to come in and listen. A lot of times there's students trying to research. I mean, the thing, people are researching addiction and all that, and they've been doing it for years and years and years. So sometimes students will come in and just observe AA meetings. And then there's closed meetings. And I remember one time I had a girlfriend who came with me to a closed meeting because she sort of wanted to see what it was like, but she didn't identify as an alcoholic. So when they give the preamble, or the sort of, not the preamble, but this is a meeting for someone that identifies as an alcoholic, she got up and left. For alcoholics only,
Yeah.
It wasn't an open meeting.
Okay. Well, that's great. It's great to hear. I feel like I've had multiple people say to me that they've considered going to a meeting, but they were nervous that they were clogging up or taking space from someone who really needed it. And it sounds more like, if you think you need it, you should go. And it's a very accepting space. Absolutely.
Oh, yeah.
Yeah.
It should be.
Yeah. Well, I think it's a good time to go to the second clip with Dr. Chuck Smith, and where he talks about his work in treatment and how successful it is, and how ridiculous the social expectations of drinking are in society. What does treatment look like? I feel like if you're sick and struggling with whatever substance, there's a lot to unpack, right? You've got guilt and shame and fear, but just so someone understands a little bit about what treatment looks like, so that they have some understanding going into it. What's day one of trying to help somebody?
Well, that's what I do. Is I'm the addiction medicine physician that takes care of the detox patients. So I see them day one, and I ensure every one of them that my main purpose is to give them the safest and most comfortable medical detox possible. So I, number one, want to keep them safe. Certainly, alcohol, benzodiazepines are very dangerous chemicals to stop suddenly due to seizures, convulsions, even delirium tremens, where they can have psychosis. I want to tell them I'm going to keep them as comfortable as possible with our medications. Certainly, opiates. We have buprenorphine or Subutex is the trade name for it, that we use to give comfortable detoxes from opiates. It turns out amphetamines and cocaine, we can just give them support with comfort medications, for example, muscle relaxers, ibuprofen, Tylenol, something safe to help them sleep. We have several non-narcotic sleep medications that we do. So no matter what the substance was, they can count on somewhere between 4 and 7 days in detox. During that time, we're going to assess them medically for any coexisting medical problems, and we're going to assess them psychiatrically for generalized anxiety disorder, major depressive disorder. Do they have bipolar tendencies, or mood disorder, or any psychosis or schizoaffective type disorder? They get that screening while they're in detox. And then that's paramount in treating them in the future, is that we're able to manage them both medically, as they would need to be, and psychiatrically appropriately. Because that dictates the rest of the care. Is would they need actual residential treatment? or would they be able to go home and commute back and forth or telemedicine with the remainder of their treatment? And what I stress to patients, even from the time they get to detox, is this isn't a 7-day or a 30-day or a 90-day program. This is the rest of your life. This is no different than I diagnosed you with high blood pressure and I gave you a pill. I don't tell you to take it for 6 weeks and then stop. I tell you take it the rest of your life, and we're going to continue to monitor you. So I want patients being seen by a behavioral health professional and a physician at least annually at the minimum to assess the maintenance of keeping addiction free or long-term recovery would be the way we use it.
Yeah. Well, there's got to be, I mean, what a shift, especially for people who are using whatever substance as like a crutch or whatever in their daily lives, shifting from that person to a person who doesn't have that crutch has got to be a heavy transition. As someone who
it certainly is.
Yeah.
For one, most have used those substances to avoid any emotional pain or any physical pain.
Mm-hmm.
Most people who use are using to change the way they feel.
Mm.
So, as you said, out of their comfort zone at that point. So, restless, irritable, discontent, depressed, bored, just not happy people during this phase. And, you know, we certainly encourage them along the way in any way medically and psychiatrically we can to ease that. We do, but there is some component that's uncomfortable to it. And I think I tell them that this to be expected. You know, this is detox.
Mm-hmm.
I can make it safest and comfortable as possible, but still, you're finally going to have to deal with these emotional pains that you've been putting on the back burner with drugs and alcohol.
Right. Yeah. And that can be a scary moment, I'm sure. What do you want someone who is just starting on this journey of getting sober to know, as someone who's gone through this and someone who presently helps people go through this process?
Well, you know, early on, I want to try to dispel some of the shame and guilt that they have,
Mm-hmm.
that they basically understand it's not 100% their fault that this happened to them. They more than likely had a genetic predisposition. They probably had adverse childhood experiences. They may or may not have dual diagnosis of anxiety, depression, bipolar disorder, or PTSD. They probably started at an early age. I agree. Some blame could be laid on them for starting at an early age, but just think in our society, wouldn't it be kind of weird if you went to college and didn't drink?
Mm-hmm.
I mean, that's the way I would have looked at it.
Yeah.
And they probably have high tolerance for the substance that they're using. That's how they got exposed to so many milligrams. So I tell them, just take that baseball bat that you're beating yourself up with and put it down, because that's not going to get you anywhere.
Yeah.
You do have this disease, and here's your pathway out. Then, after they will let up on themselves a little bit, I tell them about the prognosis for patients who are compliant with treatment. The recovery rates are near 100%.
Are they?
If you do what we ask, and we don't ask anything astronomical,
mm-hmm.
but we do ask them things that need to be done to achieve or 100%.
Mm-hmm. But still, that's good. That's positive that there, if this, then that, right? Like there is light at the end of the tunnel.
Yeah, and I think that great prognosis that they can have is enlightening. Really, it's good news. Many times patients don't want to give up another substance, and they say, you know, I only have problems with heroin, doc. Come on, surely I should be able to drink some beer. And maybe you could and get away with it. It's not our treatment plan because it puts you at high risk. Many times they don't want to give up cannabis. Many times they don't want to give up the sleeping pill. But any of the substances that we lump into mind-altering substances that dysregulate the dopamine reward system puts you at risk.
Mm-hmm.
So you have a vulnerable dopamine reward system, as we said, for all those other risk factors. If you're a compliant patient, near 100% lifetime recovery and continue to do the treatment.
Mm-hmm.
In our society, it's not just socially acceptable to drink alcohol. It's socially expected.
It is. Yeah.
Holidays, birthday parties, office parties, And it's so socially expected when you decline drinking. Many people will say, "Oh, you don't drink? Why?" That's awkward if you're a person that has our disease. So many of us, that is a coping skill. What do you say? Well, and I've been asked that many times. "Oh, you don't drink?" And when they ask, I say, "You know what? It's not good for you. Did you ever go to the doctor?" And he said, "I think you should pick up drinking."
Yeah. Yeah. And while you're at it, here's a cigarette.
Exactly. Exactly. So the card I play now is, my goal is to be as healthy and as happy as I can be, and alcohol is not on the menu.
Good for you. Yeah, it is. It's so bizarre collectively. It's like almost people who, when we're drinking, we know we're doing something at least somewhat harmful to our bodies. And if someone's not in our circle, it like creates this cognitive dissonance that we can't handle. But we got to get society to a place where we can tolerate people, not even tolerate, just accept the fact that people don't always have to be drinking. And
Exactly. And I also see this if I have a patient who maybe their spouse or a loved one does drink, and I say, I'm actually going to ask things like that you have alcohol-free Christmas parties, that you don't keep alcohol in the house. I'm not going to tell you can't have champagne at the wedding you go to and your spouse does. That'd be a personal decision. But if the spouse says, they're the one with the problem, not me, I'm not changing my pattern, then I start wondering, maybe you have the problem. Let's take you through these screening tools. So it sounds like you just got annoyed when I even mentioned leaving the substance alone.
and that's one of your 4 steps to like you've just tripped it. So let's
Exactly.
get started.
And quite often we see that the one that didn't come to treatment will balk when we ask them for a safe, sober home environment. That actually happens more than you can imagine.
I'd imagine, especially with the codependency nature of some relationships where you're doing everything together, that drinking could, you look at one partner and say like they have the problem, but you both have a little bit of a problem if you're both doing it and reacting.
And even this one I see a lot too. Say I've had a teen or early 20s with fentanyl and with the opioid crisis, what it is today, most parents get extremely fear and anxious and bring them into treatment. When we look at their home environment and find out dad knocks down 20 beers during an average barbecue. Well, we don't want to send them home to that environment. And quite often they say, "No, wait a minute, I'm almost like I'm not on trial here." And I said, "Yeah, but the environment is on trial here. We're asking your son or daughter to come back to a safe environment, and there isn't one."
Well, and it's also,
we get balks on that a lot of times.
Yeah. And well, just the idea of being like, I'm being put on trial, the defensive reaction, it's like, well, this is not a trial. We're just trying to help whomever get healthy here. So just changing, hopefully beginning to change just how we view that as it's not attacking this person's character. You were just describing what would lead to success.
Yeah, and the same way as I would ask for that a diabetic, they don't adorn their house with cakes and cookies and ice cream, and they have an ice cream dispenser and all these things. I would think that they would want an environment conducive that's going to make them easier to be compliant.
Yeah.
Easier to be diet compliant, easier to be exercise compliant. So I always relate addiction back to many of the other chronic diseases. I find patients can accept it better that way. And then once they have been given some education on the dopamine reward system and what gets regulated, I find they do. They kind of, okay, that makes sense. That makes sense.
Look who we got here. It's our friends at My Software Tutor. Can Excel be my friend? Many people have wondered this for years. The answer is yes, it can. Excel doesn't have to be like the friend that your mom makes you hang out with in elementary school. It's weird. It's always stuff with boogers, right? What's wrong? What's up? Why is that kid always eating boogers? Their house always had the best snacks, too. And there he is. Boogers. Well, Excel doesn't have to be like that weird kid. Unless you were that weird kid. Were you? Be honest. You know. I'm not actually asking. I can't hear your response, but you know. And it's okay if you were. You know, just take it easy with the boogers. Just talking about boogers to get ad read. Don't worry. They didn't write that part. That was an improvisation. My software tutor offers 3 levels of real-time Zoom-based courses with a live instructor. They deliver practical, functional business skills in a friendly and supportive environment. It can be daunting, right? You need that supporting environment to learn Excel. There's no stupid questions. It could be really difficult. And as we know, when we talk about it on this podcast all the time, it could be really daunting to learn something new and put yourself out there. So think of this as like a kindergarten for learning something new and helping your job prospects. Or be better at the job you already have. Get that raise, get that whatever, take pictures of it for Instagram. Yeah, that'll be cool. Keeping it as vague as possible so that you can input your own. Just making a mad lib of your own desires. These courses will increase your marketability, whether you're an employee, job seeker, consultant, or contractor. Register at mysoftwaretutor.com and use the promo code POD20 to save 20% off all registrations. Thank you so much to My Software Tutor. Yeah, guys, take advantage of that 20% off and confidently list Excel on your resume. So I imagine coming back to New York or as you're going through the process of getting sober, what does that feel like to sort of go back into your social circles or kind of rejoining your life?
Well, that's a good question. So it was challenging. I was with my family at first and my immediate family, and they all drink. So that was challenging.
And they didn't stop drinking around you, or was it? No. Okay. That must have been hard. Yeah.
It was challenging.
Yeah.
It's hard for people to understand what it means. I didn't have sober living. I wasn't in a rehab. I wasn't. So I just was going to AA every day and talking about it, and got a lot of good advice from people there. And that's the most important thing, is just to talk about whatever's going on. As a newcomer, there's a lot of obstacles, and even like going to an event to have gummy bears in your bag, ice cream. I ate a lot of ice cream. The one thing I did love was eating a lot of sugar, which is sort of controversial right now as far as that advice, but I heard it. I hear what I want to hear, and I would eat in my 90 and 90. I ate a pint of ice cream every day. And I just thought it's better than a pint of beer. And I definitely wouldn't do that again now, nor would I advise. But it was just sort of like the doctor talks about the reward. It was just sort of like a reward thing for me, making it through the day without drinking.
Totally. I can absolutely see that. But what would you say to someone now instead of telling them to like get with some sugar?
I mean, I would say, let's go get something to eat. Usually a bacon cheeseburger solves the problem, or a bacon or a veggie burger, or whatever you want. Something that's some kind of good soul food. That's why we spend a lot of time in diners. Yeah. You can get a lot of comfort from food. Go to the movies a lot. I was lucky. I got to be of service early. I got a chair position for a meeting after 2 months of sobriety. I got to chair a meeting, which I took very seriously. And I mean, now, mind you, I'd lost everything by this point. And so these people at this church gave me a key to their locker where all the books were, the coffee. There were a million signs from like 1970 or something, whenever this meeting started. And I would put up all the signs. So doing that kind of stuff, moving and being responsible and showing up and having them put me in this position of running a meeting helped me stay sober, because I wanted to, the next week, wanted to be sure I was there and be able to honestly say that I was still sober.
That's awesome.
So stuff like that. Yeah. And then as far as like coming back into improv and And that whole scene, in the beginning, it was harder because I was sort of getting my stage legs back, and I was over at what was called This Theater, and a lot of the performers were drinking on stage. So I had to sort of learn and create boundaries as far as like what I will do and what I won't do, and who I will play with and who I won't play with. Mm-hmm. And I don't judge. I mean, when I used to improvise in my 20s, I was drinking. We were all drinking. But now it's just like for my own safety and the people around me's safety, I have these boundaries. And I think if improvisers approached improv in a professional way, perhaps improv could be an actual profession. I don't know. Sometimes it feels like it's like nobody shows up to the play they're doing drunk.
Right.
But I mean, I used to, because I'm an alcoholic. I used to have a rule, never drink before I was on stage. And then by the end, I couldn't not drink without going on stage.
But it's very different. Like the New York City improv scene, it's always like a party. It's always something to celebrate, right? Like drinking is like holding hands with improv, unfortunately, in New York. Whereas performing here, it's a little different. It is more professional.
That's awesome to hear.
Yeah.
I mean, I think some people have it's a strange business, the liquor business, and I don't know. I mean, if you're in the liquor business, I mean, when I used to do ASCAT at UCB, we would bring our own beers. We weren't selling alcohol, but we were bringing it. Yeah, I believe that for some people, it's a social party situation. And for others, it's a weird art form because it feels like a party and a meetup. But at the same time, the idea of following the fear, and then to have a drink, which eliminates the fear, is those are two different messages.
They really are.
So if we could, separating the two, I think is really important. To go drink after your show.
Completely agree. But even after the show, it just became so routine for me that like I eventually needed to like take a break from it or slow down rather.
Yeah.
Just because there's an excuse every single night to do it.
Oh yeah.
Yeah. One thing that
I just go home. I just leave.
Yeah. But then you feel like you're not going to get invited.
Sorry, go ahead.
You feel like you're not going to get invited to other people's show if you're not like sitting around and like drinking with everybody. Like, oh, like Pat doesn't hang. But that may be real or not real, right? That may be something in my head.
Well, it's funny. Like the people that that did really well, like people like Mike Myers or Tina Fey, they weren't really known for hanging out at the party. They had, but yes, I hear you. I had that feeling of like, oh, I want to follow this and go to this and do this. And the next thing I know, it's 4 a.m. I mean, I just like the party aspect of it is alluring and very tempting. It's important to know that there's like an end game. So if I'm going to go improvise, it's because I love to improvise and I want to be seen. And then it doesn't have to be, it's like any sort of profession. It's just like, I go, I do my job, I do it, and then I don't have to go to the party afterwards.
Yep, absolutely. Yeah. And that's what I've really liked about performing here at Theater 99 in Charleston. It's professional, phones are away. We're in the green room. We're hanging out. We're connecting.
I love that.
And then, we do our job and crush it every goddamn night.
I'm coming. I want to come down there.
You really should. I'd love to get you involved or maybe do a show with you. That'd be so fun. It's a great space and it's hopping. So yeah, we should make that happen. That's great to hear that. Yeah. One thing that the doctor said that really jumped out to me is like the level of success in treatment. I mean, he adds the caveat of you really have to stick to it. You can't have other crutches of he pointed out like sugar or marijuana. I sound like a cop, just like weed. Are you a cop? Yeah, you sound like one. But yeah, that's a great outlook that people really can do this.
Wait, so the doctor was saying you about, what was he saying about weed?
He was saying that in treatment, like in general, for whatever you're coming to treatment for, the success rate is almost 100% if you follow the steps. It does, like, let's say you come in for alcohol, it doesn't mean that you can then have weed gummies, right? Like you have to kind of live cleaner, but you can altogether get yourself sober and stay that way if you follow the steps outlined.
Yes. I don't know if that, I mean, he's a doctor, so he would know more than I. Mm-hmm. I know people that have done other ways besides AA and the 12 steps that are perfectly happy. I know what works for me. The 12 steps can be overwhelming to somebody that comes in. They mention the word God more than they mention the word alcohol. So it can be, I think that it's important that there are alternatives. And I think there are a lot of alternatives like Smart Recovery or Life Ring or harm reduction, whatever it takes to help somebody who needs the help so they don't kill themselves.
Right.
And then if they identify as an alcoholic or an addict, whether they go to AA, NA, or gambling problem and they go to GA, or they're powerless over sex and love and they go to SLAA, hopefully their journey there will be guided rather than forced, because you do get people mandated to AA. And I've signed some of their certificates before and they resent it. They really strongly resent it.
Yeah.
So
in that sense, it's kind of like a prison sentence, right? Like you can't, it doesn't seem like something that you can do forcibly.
Well, people try. They certainly try. I mean, I think the intent is good, which is go to meetings and you'll hear something that you identify with. And I'll know where my loved one is from this time to this time. They'll be in that meeting. But I think it's important to look into all the ways, especially if you're in a small town and you don't want people to, if you have a problem, you could shoot. Well, the great thing about the Zoom meetings during lockdown, we all sort of turned to Zoom, was you would get a lot of people that were kind of concerned about going to their local church in the small town. And then if they didn't get it or didn't like it, being labeled as an alcoholic or being judged or whatever.
Right.
So they could show up on the Zoom meetings, a Zoom meeting in Ireland, and then try it out that way. But there are the steps. I love the steps. I'm a huge fan of the steps. The steps changed my life for the better, but I don't want to say AA is the only way.
Yeah. That's great to put that out there, because yes, it's one way. It's a great tool. It's helped people for 75 years at this point.
Almost 100.
Oh, has it been even that long? I didn't even realize. See that? But yes, It's not the only way. And just mean that that's it, is what it is. There's always more than one way to be successful. And so.
Totally.
Yeah. What's the best thing that someone around an addict can do to support them? I mean, it may not be one thing, it may be multiple things, but in your opinion, what's the best way to be supportive of someone who is either thinking about trying to get sober or in the process of getting sober?
It's a great question. I think if you are worried about somebody in your life, the best thing to do is lead by example.
Okay.
Don't use around them. Try and create things that are fun that don't involve using without talking about the fact that this is a thing without using. Try and allow them to discover on their own that they don't have to use in every moment.
Right.
It's very hard. The things that we put our loved ones through, it's very hard. It's just sometimes you have to shut the door. You have to say, I can't help you anymore. That's definitely what happened to me. And that is the point that most of us will push people towards, unless designing and putting together an intervention, trying to find out where the rehabs is. Everything you can to help save this person is the first thing you want to do. Absolutely. And you just hope that it sticks.
Right. Absolutely. Yeah. Unfortunately,
there's a whole group that is designed for the people that love us called Al-Anon, which is for people that are in relationships with either active or sober alcoholics.
I've never heard of them. So that's a great resource to put out there.
Al-Anon is a tremendous program. It's great.
Okay. Yeah, that's great. I'm going to look into them. Yeah, that's especially to see if I can come up with a few more things. Well, I think it's a great time to go to the third and final clip with the doctor, where he talks about how people can support people in treatment and his relationship with AA.
All right, you've got an event coming up. You know you got to send a card. So you get the card. It's looking good. You know, you chose a good one. You grab a pen. You sit down. And then your mind is blank. You don't know what to say. It can be daunting. There's a lot of pressure. You got to fit it in a certain area and got to look nice. Go easy on yourself. There's someone here to help you. Introducing the Cardist Studio. With so many birthdays and occasions, there's no time to shop for cards, write the cards, and buy the stamps. It's too many steps. So many chances for anxiety. Now you can do it all right where you sit. That's the best. That's the best. Because the Cardist Studio does it for you. They write it down for you. Introducing a writing specialist for the message inside your greeting cards. Don't get those canned responses. Have someone write something truly heartfelt. By the way, this is my friend Mary Alice who runs this company. She's very good. She sent me one of these. Whew. I know I said that in a joking tone, but I mean it. It was very thoughtful. She sent me one after my grandfather passed away. It means a lot. I still have the card. I mean, that shows you all you need to know. All right, here's how it works. All you do is pick the card and tell why you're sending it. No more errands. No more anxiety. For a message from your heart, but not your hands. It's okay. You still mean it. Sit back and just enjoy your relationships. Wouldn't that be nice? TheCardistStudio.com. Thoughtful, just got easy. And you can use the promo code AnxietyPod for 10% off all orders. All right, friends, get out there and send those greeting cards from the Cardist Studio.
On top of creating a positive environment for a person in treatment to live in, how else can someone who's around a person in treatment best support them?
As I said, they actually start promoting alcohol-free events or alcohol-free parties that they actually participate in some sort of 12-step mutual aid to self, so they get a better understanding. Al-Anon has been the one famous over the years that families participate in, and that gives them a layperson version of cognitive behavioral therapy. So they start seeing, okay, nagging doesn't work. What actually works is holding accountable and being supportive. I mean, you wouldn't nag at someone because their blood sugar was 400. You would get them help.
Right.
So, someone leaving treatment, I even use that old, I think it was Ronald Reagan that said, trust but verify.
Yes.
Someone comes out of treatment, it's not inappropriate to have a breathalyzer at home. It's not inappropriate to ask for urine drug screens. Whenever I have a patient who leaves treatment and they're not going to be monitored, I look at that same as in the diabetic home without a glucometer. I'm saying, well, I think your blood sugar will be okay. We'll just guess at it for a while. Of course not. We get an objective test. So monitoring for alcohol and drugs are objective tests. And with our outpatient programs, we do that. When patients come back in, periodically we do testing.
Yeah.
And the quicker we spot a relapse, the less intense treatment we have to do. Now, if we catch them after one drink, obviously they don't have to go through detox again. There won't be withdrawal. We just increase the level of care.
Yeah.
So that is what I stress to families is be supportive and learn from us how to be supportive. And that is accountability. Learn about the disease yourself. Remove casual use of substances.
Yeah. Those are all that's great advice. Well, tell me a little bit about your book. What's it called? And
Oh, actually, I have it. I can show it to the camera here. It's
nice.
Understanding Addiction, No Science, No Stigma. And it was written by both myself and Dr. Jason Hunt, who's an addiction medicine physician at the University of Florida, who I met in treatment in 2009.
Mm-hmm.
And we worked on this book for several years, and it came out on Amazon last June. And it's actually doing well. It's been in the top 30 of Amazon addiction books. For both of us, we've never written a book before and have no experience in publishing or anything like that. So I've been pleased with it. I really wrote it so I could give it to patients and families that I was taking care of. But we've been getting some good reviews on Amazon, and now some people that don't know me and Jason have been giving reviews back, and I'm pleased with that.
That's awesome. Congratulations.
Thank you.
Well, is there anything you think I'm missing related to addiction or your story?
No, I don't think so. I end with each patient. Just remember, you have a vulnerable dopamine reward system. You have risk factors, or this wouldn't have happened to you. This is lifetime management.
Mm-hmm.
And as long as they can keep up with that, they're going to be fine and have a much better prognosis than, say, diabetes, hypertension, heart disease. As you said, compliant patients approach near 100%. And when I stress that to them, that isn't what we see in the world. Out in the world, we get relapse rates as high as 80%.
Mm-hmm.
So, but as I said, that's always due to non-compliance.
Right.
Did you do the things we asked? And their answer back was, well, I didn't think I needed that part. And I said, well, we need to rethink that then. And you need to get your priorities in a row. Do you really want this? If you really want it, it can happen for you.
Yeah. Well, what a takeaway that this can happen for anyone as long as you follow the steps. I mean, what a beautiful thing. Well, how can people, are you active on any social media? How can people get a hold of you if they'd like to?
Yes, actually, I have Instagram that's dr.chucksmith. And I have Facebook that's Dr. Charles space Smith, and it actually links from the Instagram also. I also have a web page. It's helpsaddiction.com. It's in the book, and I collect emails from there and periodically send out information, kind of like a newsletter to patients and families who've given me their emails, and some things I post on Instagram, things I post on Facebook, new articles, different things in the field of addiction. And I enjoy having followers there and really enjoy communicating with them.
Awesome. And what's your relationship with AA?
Oh, I have I worked the steps back when I was in Alabama after treatment. Probably the average Saturday for me was 5 AA meetings. I had a sponsor. I worked the steps. I still sponsor other men. I'm active in the fellowship. I think the AA Big Book of Alcoholics Anonymous was voted one of the 100 books that changed the world. Mm-hmm. So obviously it's one for the ages, and I've read it many, many times, and was really, I was just really overwhelmed. They wrote a book that detailed my life about 30 years before I was born. Mm-hmm. As I was reading passage after passage out of AA, I was going, all right, this is true. The alcoholic, for example, the alcoholic lives a double life. Certainly I lived a double life. Mm-hmm. That alcoholics crave that comfort and ease that comes with just a few drinks, is another quote out of the book. It says those drinks they see others take with impunity.
Yeah. AA must be so helpful in describing some of the things that you mentioned were helpful for people in treatment, in that it's like a peer support system and helps give you a 12-step program that you can stick to. So that's great to hear that it works. And I mean, it's been working for how long?
New people, places, and things that I can start associating with people who understand that alcohol isn't necessarily associated with success, reward, and celebration. Because society puts it there. I mean, watch any alcohol commercial come on TV. They're celebrating something or rewarding themselves for something. you never see the patient entering detox on an alcohol commercial.
Right. Or someone just crying while drinking a beer that they don't want to be drinking. It's always a party, or, the broken relationships. Yeah. It's always positive and up and sexy people. And yeah, it doesn't reflect the reality of where it could lead.
Yes, I agree.
Yeah. Well, thank you so much for your time. This has been very enlightening, and I'm going to take that almost 100% takeaway and run away feeling very positive.
Okay. Well, I look forward to speaking to you again. If you have any other related topics, I mean, you can either reach me through Maz or my Instagram. Like I said, Deezy, and I respond to it all the time. Just dr.chucksmith. And if you have another topic, the opioid crisis or medical marijuana, anything you'd like to discuss, I'd be happy to come back.
Awesome. That's a great idea. I'll definitely take you up on that.
Thank you.
All right. I'm going to ask you a question that's a bit personal. And feel free to push back. You mentioned the relationships that you push people towards a boundary of them closing a door. What was it like trying to open that door?
Well, I think the great example is the relationship I had with my mother.
Mm-hmm.
And to be able to reconnect with her in sobriety was an incredible gift.
Mm.
She died when I was about 6 years sober.
Okay.
But
yeah,
she got to see me as a sober person. And I'm extremely grateful for that.
Yeah, man, that's fucking awesome. That's awesome.
Yeah.
I'm so happy for you. Yeah. That's great. I mean, what an emotional roller coaster I'm sure that must have been. So I'm very happy for you. Well, what would you say? I mean, I don't know if you had more to say about that. I'm sorry, I didn't mean to cut you off. No, okay. What would you say to someone that's getting started down the road of sobriety? Is it sort of a cheerleader message, or it's just sort of like ask around and do some research and find out what works for you?
I would say don't be afraid, first of all, to ask for help.
Mm-hmm.
Go to a meeting. Speak your truth.
Mm-hmm.
You don't have to drink today.
Mm-hmm.
And don't worry about the God stuff. If you're going into AA, don't worry about it.
Mm-hmm.
Don't worry about it.
Yeah. I can see that being like, I wouldn't know how to handle the God stuff if I was going into AA. So I completely empathize with that. Yeah, but that's a good message. It's just sort of is what it is, I guess. And it really works for some people, like in its totality, but it doesn't have to be if that's not your thing. Yeah. If that's not your thing, that's not your thing. It's okay.
It's a whole, it's a spiritual program. It's not religious. And just remember that. And if your local AA group feels overwhelming to you, try going to one in a different place on Zoom. Because you'll find the help you need.
Yeah, it's out there.
Yeah, it's out there.
Yeah. And that's a beautiful thing.
The best thing about AA, besides the steps are great, but talking to someone who knows what you're going through is really what it's all about.
Yeah, absolutely. Yeah. I mean, my only comparison of experiences is like, I've had problems with anxiety and depression, and times I've communicated with someone, it like opens it's like, wait, like it's not just me, and like you understand exactly, the days of the blanket over my head hiding from the world.
Oh yeah.
Once you hear that, I don't know, I feel like once I started hearing that over and over again, it like helped me start to seek treatment for it and get the help that I needed. And so I'd imagine it's the same thing here, where it's just like someone is just speaking your language, man. Like they know your story without knowing.
Oh yeah, and anxiety and depression are huge with us. We are. Yeah.
I'm
oh
sure.
yeah.
Yeah. Well, is there anything you think I'm missing related to your story that you'd like to share, or getting sober or
Well,
supporting
it's
someone?
never too late.
Mm-hmm.
Almost always, I think behind the addict is a good person.
Mm-hmm.
So, it's important to know if you love somebody that's struggling, it's important to know that the good person is there.
Mm-hmm.
They are not in control anymore. Their life is being run by the drugs or the alcohol. And it's a tremendous gift to get sober. It is a tremendous gift.
Yeah.
So don't, if you get it, hold on to it, hold on to it, hold on to it. It should be your priority
Yeah.
every day.
Yeah, that's amazing. Well, thank you so much for sharing all this with me and with the listeners.
Thank you.
Where can people get a hold of you on social media? And I know you also have a podcast.
They can follow me at the Patrick Mac on the Instas.
Yeah.
And I do, sometimes I do a podcast with Centralia Improv, who is some people that I improvise with in New York. And whenever I host one, I usually put it up on my Instagram. So
Cool.
you can follow me at Instagram at the Patrick Mac, or you can come to the People's Improv Theater and take a class
Absolutely.
in New York City.
Yeah. I mean, taking an improv class changed my life for the better. And I really think it can do, whether you pursue it and keep wanting to perform, or it's just sort of like giving you the tools to be comfortable in uncomfortable moments of your life.
Yes.
Improv
And you're
is
such a
awesome.
good improviser, Pat. I'm so
Thank
glad
you.
you're still doing it.
Yeah. I'm so glad I've rekindled the love. It kind of faded there for a while.
Yeah.
But
That happens. That happens.
Yeah. So, yeah. And Centralia is absolutely fucking hilarious. So, yeah, definitely go see them and listen to the podcast. Well, thank you so much, Patrick.
Thank you, Pat.
Yeah. Have a good one.
All right. You too.
I really just want to stress to people that you've heard it a few times throughout this episode. There's always hope. There's always help. Can't say that enough times. Addiction is definitely a disease, and the good news is there really is help. People who understand what you're going through are out there, and even if you're supporting someone who is having a hard time, there's groups out there that can help you support and get you mental health help if you need it. I mean, because it weighs on the people around. Or addiction can weigh on the people who surround the person who is struggling with that and battling that. So yeah, I hope this episode was really helpful. I wanted to shout out a listener named Hannah. I hope I'm saying it right, because I also know I have a friend named Hannah. I hope I'm saying your name right, Hannah. Hannah reached out on Twitter and talked about how she's been listening to the show and how it's helped her develop a better relationship with her anxiety. I mean, not just the show, but she also mentions her husband, Dave, and how helpful he's been and how she's in a much better place. And I'm so honored and humbled that you would share that with me, Hannah, and glad to hear you're doing well. So shout out to you. So I'm always thrilled to hear from people who are listening to the show. So thank you so much for listening, yeah, and for reaching out. Well, I also want to mention my other podcast called Death Space Filling the Void. You can get it wherever you get your podcasts, or by going to deathspacepodcast.com. You can support the show by clicking the Buy Me a Coffee link in the description and making a donation. Any amount that you feel comfortable with, that really goes a long way towards keeping these going. There's also the Instacart link, which is in the description as well. By clicking that link and signing up in that way, you're telling Instacart that this show sent you, which also helps support the show. There's also My Software Tutor with the promo code POD20, which will give you 20% off. Go to mysoftwaretutor.com. The link is also in the description. And then there's the Cartus Studio with the promo code AnxietyPod, which gives you 10% off at thecartusstudio.com. And I'll also include links for Pat McCartney and Dr. Chuck Smith, and a place where you can find Dr. Chuck Smith's book. and as well as resources like AA, that if you're interested in trying to get sober or trying to support someone, those links will be in the description as well. A lot of important stuff down there. Well, as always, thank you so much for listening. I really hope that this episode was helpful. It's certainly not something that's taken lightly. Have a great week, and I'll talk to you on Thursday.